Hey everybody, Dr. Steve here with Kinesi, and here is your Wiggle of the Week, part 1 for the low back. Okay, so as you've seen from the pattern of the previous videos, we're going to start with localized mobility, and we're going to do some movements specific to the low back, trying to just get it moving a little bit better. How we're going to do this is laying down onto our back so that we're in a nice supported position. Of course, we're going to hit all 3 planes of motion. So your knees are bent up, and you're going to simply start with rocking your knees side to side. You get yourself into a nice, comfortable rhythm, and you just go as far as you can go comfortably. Doing higher repetitions tends to work well with this one because it lubricates the spine, it gets things moving, and it just kind of helps everything with a nice pumping action. So that was the transverse plane. Next, we're going into the sagittal plane. So this is where we're going to be rotating the pelvis forward and back. So you're rocking back and then rocking forward. This is sometimes called a posterior tilt and an anterior tilt of the pelvis. You're just going forward and back. As you rock back, you try and flatten your low back to the floor, and then you let it arch up a little bit. Then in the frontal plane, we're going to do the side to side. I call these tail wags. And this is where you're kind of wagging your tail or swishing your hips from side to side, trying to bring one hip up towards that shoulder. Good. So those are your initial localized mobility for the low back. Remember, for this month where we're targeting the low back, anybody, you, friends, or family that have some low back issues that you'd like to get checked out, send them into Kinesi and we'll do a free assessment. We'll come up with a personalized and individual movement prescription, and be sure to share us and like us on Facebook. Share this with as many friends as you have, and we can help more people wiggle their way to joy.